Hi friend, I am Dr. Mohammad Abdullah Saleem. I am a consultant pulmonologist, Care Hospital, Malakpet, Hyderabad. Have we already discussed about the various lung diseases like asthma, pneumonia, tuberculosis and air pollution earlier in the videos. Now I am going to tell about the one more disease called interstitial lung disease. What is this exactly, interstitial lung disease, and what are the causes, how to diagnose and how to treat the interstitial lung disease, and how to live or interstitial lung diseases. Before going to this disease, I would just give information or highlight about how the lungs give breathing or do breathing. What are the structure which is responsible for respirations? There are 5 different parts of the lungs which is responsible for breathing. First is your airways, that is your air wings or bronchioles. Second is your lung parenchyma, that is tissues of the lung. Third is the blood vessels, and fourth your nervous system, which gives information for breathing or respiration. Fifth is that your thoracic cage, which work as a handle pump movements. So once the air enters into your body through these airways, it enters into the lung cavity, parenchyma. From the lungs tissue, there are terminal, it passes to the blood vessel. From the blood vessel, it is distributed throughout the body. Once the air enters into our lungs, there are structure called alveolar sac, which is a terminal or last part of the lungs. This terminal or last part of the tissues are responsible for transportation of air. When there is an error or any damage to this alveolar sac, cause an error in transportation of oxygen. In the alveolar sac, there is a smooth layer or epithelial tissue layer which play a main important role in the oxygenation. Is called as interstitial. This is a smooth thin layer around the alveolar sac which carries the oxygen from the airways and it transports the blood vessels, and from the blood vessel it carried carbon dioxide and transport to the lungs, and from the lungs it passes through the airways and it is exhaled. So this is the normal cycle of lung respirations. What happens in interstitial lung disease? When these interstitial layers or the thin layer of epithelium in the sacs got damaged or fibrous or destroyed, any infections, any allergies, prevent the infected or anything happen to this epithelium causes interstitial lung disease. So this is basically the disease of the interstitials, hence it is called interstitial lung disease. There are many causes or risk factors for the interstitial lung disease. There are more than 2,000 of causes of interstitial lung disease, in which there are few of them we know, and there are many unknown interstitial lung disease. And there are different type of interstitial lung disease, such as occupational lung disease, drug-induced interstitial lung disease, autoimmune interstitial lung disease, interstitial lung disease due to the exposure to specific toxins specific to the antigens. So for example, there are hypersensitivity pneumonitis. This is called, it is due to the hypersensitivity reactions between the outside antigens, and when it enters into the body, it causes destruction of interstitium called interstitial lung disease. It is also one type of ILD. So it is the main causes of this interstitial hypersensitivity pneumonitis is the exposure to the pigeons, exposure to the birds, and exposure to the organic substances. Most of the most of the families keep birds in their homes, parrots, pigeons, for their as a pets. This may be a cause of interstitial lung disease, which is rising gradually. And other diseases is sarcoidosis, and thus individual who is working in a cement factories causes asbestosis. It is also one type of interstitial lung disease, and it is occupational lung disease, which includes individual working in the coal mine causes coal mine lung disease. The individual who is working in the farmer fields called as farmer lung disease. Individual working in the grass or any grain factories are called farmer lung disease or brucellosis, and so on. So there are many different type of ILDs. So what are the causes of these ILDs? How this individual come to the doctor? Most of the individuals with the ILDs in an initial stage complains of cough, which is dry in nature. There is no productive cough, chest tightness, and in some cases breathlessness, which is worsening gradually. These are the common symptoms of individual with cough, breathlessness, and chest tightness. In some cases, the patient will come with a reduced appetites, multiple joint pains, and there are skin rashes are also there with breathing. So such kind of common symptoms comes with interstitial lung disease. There are many different patterns of ILDs called as idiopathic pulmonary fibrosis, where the causes is unknown, and depend upon the patterns we have diagnosed hypersensitivity pneumonitis. And how to diagnose this hypersensitivity pneumonitis is how to diagnose the hypersensitivity pneumonitis or interstitial lung disease. Diagnosis of hypersensitivity pneumonitis is based on the patient's clinical history, which is one of the most important part of the diagnosis. The second is the doctor will advise for HRCT or radiological evaluation, and the doctor will advise some blood test to rule out autoimmune process or autoimmune diseases like rheumatic arthritis, silicosis, asbestosis, SLE, Sjogren's syndromes, and so on. So these are the common findings. If doctor, in some cases, the doctor will advise, if they don't get the causes of ILD, they advise for the lung biopsy as well. And what are the different type of treatments, and it is depend upon the type of interstitial lung disease. For example, if it is autoimmune related interstitial lung disease, autoimmune related ILDs, then doctor will advise mainly the steroids and some of the immunosuppressants, like in the case of rheumatic arthritis related ILD, that is called as RA-ILD, they will advise methotrexates and other immunosuppressants for ILD, RA related ILDs. Similarly, there are another diseases called sarcoidosis, hypersensitivity pneumonitis, where the steroids are more commonly used. Most of the patients with ILDs develops a fibrosis as their age goes, or the disease is very fast progressing. Such patients are required immunosuppressant like myclophenolate, mofetil, MMF, or the doctor will advise in pulmonary fibrosis antifibrotic drugs called as Perfinex or Nintedanib. So these individuals advise according treatment according to their type of the ILD, and doctor will treat the according to the your conditions, and they will change the medication as per their your condition. And the individual, those who are living with a advanced stage of ILDs, in such conditions we doctor will prescribe medications along with the rehabilitations. Rehab means the patients will require oxygen support, which may be mobile or stationary oxygen supports, and with few of the medications and vaccinations. So these are the breathing exercise. Few of the breathing exercises are also advised by the doctor to prevent further progressions, and advised good nutritional support to prevent proper vaccination to prevent further respiratory tract infection. Because of reduced immune systems, reduced lung immunity, secondary infection can easily be happen with the patients with steroids and other immunosuppressants. So with this, doctors will advise you have a rehabilitation rehab for the further life, and modify the lifestyles. Good nutrition support, vaccinations can prevent the further progression or secondary complication related to ILD. Periodical check with your pulmonologist, and the proper diagnosis and proper prevention is much better than the treatment for ILDs. Thank you.